So, based on our first half of the history, observation, and palpation, I suspect that a lot of Cheyenne's back pain is coming from her scoliosis, and she has very tight muscles along her paraspinals, her hamstrings, and quads. So, to start off, we're going to do range of motion testing, and I'm going to start with her cervical spine. So, go ahead and scoot to the edge of the table, and then go ahead and look down. Good. Look up. Any pain with that? Okay, side to side. Good. Any pain with that? And then tilt. Good. Any pain with that?
No, it's just tight.
Okay. And then go ahead and stand up. Alright, go ahead and bend all the way forward. Any pain with that? Good. And then arch back. Any pain with that? Good. Side to side. Any pain with that? Good. And then rotate. Any pain with that? Good. Alright. Now we're going to do hip range of motion. Go ahead and sit down. Okay. Go ahead and lift this knee up. Good. And then other one. Good. Lift that one up again. And then you're going to internally rotate. And then externally rotate. Other side. In. And then out. Any pain with either of those? Good. Okay, go ahead and lay on your stomach. Okay, go ahead and lift your leg up. Good. Other side. Good. Any pain with that? Nope. Okay, and then go ahead and I'm going to bend this one. And then go ahead and lift your leg up. Any pain with that? Okay, other side. Any pain? Nope. Good. Okay, go ahead and lay on your side.
Which side?
Either. Okay, and then lift this one up. Good. Bring it back down. Any pain with that? Good. Other side. And up. And down. Any pain? No. Okay. Good. Now we're going to move on to manual muscle testing. So go ahead and sit up again. And we're going to start with cervical and make our way down. Alright. Go ahead and tilt your head down. Good. Go ahead and I'm going to try and pull you up. Don't let me pull you up. Any pain with that?
No.
Okay. Head back. Don't let me pull you up. Good. Okay. Turn to the side. Okay. I'm going to rotate you in. Don't let me. Good. Other side. Don't let me rotate you in. Good. And then to the side. Don't let me pull you up. Good. And then other side. Good. Okay. Now we're going to move on to lumbar. Go ahead and lay on your back. Okay. Put your arms behind your head. And then I want you to lift up like you're doing a sit-up. Good. Any pain with that? Okay. Go back up. And then go side to side. Any pain with that? Good. Okay. Go ahead and lay on your stomach down. Okay. And I'm going to hold your feet down. Go ahead and lift your upper half up like you're doing a Superman. Good. Any pain or tightness with that?
A little bit of tightness here.
Okay. And then while she's here, I'm going to start with her hip manual muscle so that she doesn't have to switch positions. So go ahead and lift this one up. Good. And then lift this leg up too. Okay. And then with extension, this is isolating her gluteus max, so don't let me push you down. Good. Other side. Don't let me push you down. Good. And then go ahead and lift this one up again, but keep it straight. Good. Don't let me push you down. Good. Other side. Don't let me push you down. Good. Alright, and then go ahead and flip onto your side.
I didn't know I was going to get a workout in here.
Here it says abduction and adduction, so can you scoot closer to the edge? Good. Okay. Go ahead. I'm going to lift this one up. Hold it there. Don't let me push you down. Good. And then I'm going to go ahead and hold this one here. Lift this one up. Good. Hold it there. Don't let me push you down. Good. And go ahead and flip onto your other side. Good. Don't let me push you down. Good. and then this one here, gently push it down. Good. And then go ahead and sit up. So far, both sides feel equal bilaterally when comparing abduction, adduction, and extension, and then isolated extension to isolate gluteus max. Okay, go ahead and scoot to the edge of the table. Okay, go ahead and lift this one up. Hold it there, gently push it down. Good. Gently push it down. Good. Hip flexion is equal bilaterally. Go ahead and lift it up again. Okay, I'm going to internally rotate you. Hold it there, gently push you out. Good. And then I'm going to externally rotate, gently push you in. Good. Same thing on this side. Good. Out. Good. Internal and external rotation feel equal bilaterally. Now that we've completed manual muscle test, I'm going to move on to special tests. So the first special test I'm going to do is a Thomas test, and that will be testing for tight rectus femoris or iliopsoas. So go ahead, and I'm just going to have her positioned like this since we don't have a table without a bedpost. So go ahead and pull this one in. Good. Good. Her leg does not come off the table on this side or straighten, so that would be a negative test. And since not just one side is affected, she's having pain on both sides, I'm going to test both sides bilaterally. So go ahead and go ahead and pull that one in. Good. And she's not positive on the other side too. So now we're going to do an Ober's test for tight IT band. So go ahead and lay on your side. Okay, go ahead and bend your legs. And I'm going to go ahead and hold this one up. Okay. And once I let go, if her leg stays, then that would be positive for a tight IT band. And if her leg drops, that would be a negative test. Okay, that would be positive. Then go ahead and flip to the other side. Okay, same thing. Okay, so tight IT bands on both sides. And then go ahead and flip onto your stomach, and we're going to do an Eli's test for tight hip flexors. Ouch. Okay, go ahead. I'm going to just bring this one up. Good. And what I'm looking for is to see, I'm just going to slide this out from under you. Okay. And what I'm looking to see is if her hip comes off the table, and her hip does not on this side. Okay. And then go ahead and and it does not come off on that side either, so that would be a negative test. And then go ahead and sit up. And I'm going to perform a Valsalva just to ensure that she doesn't have a herniated disc or any nerve pathologies, just to rule that out. So go ahead, and what you're going to do is you're going to hold your breath or cough while you're bearing down like you have to go to the bathroom. Okay, do you have any pain with that? Okay, negative Valsalva. So lastly, what we're going to do are dermatomes and myotomes for the lower extremity. So go ahead, and we will start with myotomes. So we start with L2. L1 and L2 are the same, so go ahead and lift this one up. I'm going to hold for 5 seconds. 1, 2, 3, 4, 5. Good. Hold it there, don't let me push it down. 1, 2, 3, 4, 5. Good. L1 and L2 are equal. Go ahead and extend out. Go ahead and flex your foot. Good. Don't let me push you down for 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Okay. L3 is equal bilaterally. Go ahead and extend again, and then bring your toe up. Good. hold it there, don't let me push you down. For L4, 1, 2, 3, 4, 5. Same thing. 1, 2, 3, 4, 5. And then for L5, go ahead and hand me, go ahead and bring your foot up, flex, and then I'm going to bring your big toe out. Don't let me push you back. Ready? 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Okay, L5 is equal bilaterally. And then go ahead and extend again. And then invert. Hold it there. Don't let me bring you out. 1, 2, 3, 4, 5. Same thing. Don't let me pull you out. 1, 2, 3, 4, 5. S1 is equal bilaterally. And then go ahead and lay on your stomach.
I don't know why that took so long.
Okay, go ahead and lift this leg up. Hold it there. Don't let me pull you down for S2. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Okay, S2 is equal bilaterally. And now we're going to start with dermatomes. So go ahead and I'm going to have you stand up. This is the tool I will be using. And what I'm going to have you do, we're going to do a test run. So this is the sharp side and this is the dull side. Can you feel the difference? Okay, what I'm going to have you do is go ahead and stand with your feet apart. Good. And then what you're going to do is close your eyes and I'm going to ask you if you feel the sharp or dull side. Okay, starting with L1.
Sharp. Dull.
Okay.
Sharp. Sharp.
For L2, L3.
Dull. Sharp.
Okay.
Dull.
Good. L4.
Sharp.
Good. And then L5.
Dull.
Good.
Sharp.
Good. And then go ahead and turn around for me. And now we're going to do S1.
Sharp.
Good.
Dull.
Good. And then S2.
Sharp.
Good.
Sharp.
Alright. Dermatomes and myotomes are equal bilaterally. And from this I can conclude that Cheyenne is having her back pain from her scoliosis and tight musculature.